Your loved one was told they have peripheral vascular disease. Maybe they have had it for years. The doctor explained what it is, gave them a medication list, maybe talked about diet and exercise. But now, the pain is coming every single day. The feet are cold, the wounds aren't healing, and no one has told you what to do right now in the middle of this pain. That's exactly what we are going to talk about today. Hi, my name is Rupal. I'm a registered nurse with experience in hospice and palliative care, licensed in Texas and Illinois. I make these videos for patients and families, not to replace the doctor, but to help you understand what's happening and feel prepared to take the next step. Today, we're talking about peripheral vascular disease, what it does to the body, why it becomes so hard to live with, and how palliative care can help you manage it day to day. Peripheral vascular disease, or PVD. This was introduced briefly in our episode 16 when we talked about different types of cardiovascular disease. But today, I want to go deeper because this is a condition that affects millions of people, and many of them are suffering quietly. Here's the thing about PVD. Most of the time, patients get excellent information on controlling the disease. Take your medication, watch your diet, stop smoking, keep your blood sugar in check, and all of that is important. That guidance is right, but there is a gap. What about the pain that wakes you up at 3 a.m? What about the cramping that stops you from walking to the mailbox? What about watching a wound of your foot that simply won't heal? The medical system does a good job explaining causes. It doesn't always do a good job explaining how to live with the symptoms. That's the gap. Palliative care helps you fill. So let's first understand what peripheral vascular disease actually is in simple terms. PVD, peripheral vascular disease, is a slow, progressive disease of the blood vessels. It affects the arteries and veins outside the heart and brain, primarily in legs and feet. Now, over time, the vessels narrow, they get blocked. Plaque that is built up, blood can't flow the way it's supposed to. And when blood can't reach the legs and feet properly, the symptoms begin. Cramping, pain, numbness, a constant coldness in the feet, skin changes, slow healing wounds that become infected, and in severe cases, tissue begins to die, and that can lead to amputation. One of the most common underlying causes for PVD is long-term uncontrolled diabetes. When blood sugar stays elevated for years, it damages the blood vessels slowly and silently. Now, by the time symptoms are obvious, the disease has usually been progressing for a very long time. Some other common factors include high blood pressure, high cholesterol, and smoking. But here is what I want you to understand today. You can be doing everything right, taking your medication, watching your diet, going to your appointments, and still be experiencing significant pain. Still be losing sleep, still be unable to do the things that make you feel like your own. That's not a failure. That's what this disease does. And that's exactly why symptom management matters so much. Palliative care is not a last resort. It's not hospice, it's not giving up. Palliative care is an additional layer of support for people of any stage of serious illnesses. That focuses entirely on quality of life. Now, for someone living with the PVD, palliative care can prescribe medications that can calm the nerves and reduce pain more effectively, help manage emotional weight of living with the chronic painful condition, connect you with community resources and support groups, people who understand the same fight. prepare you and your family for conversations about what comes next so nothing catches you off guard. Palliative care does not stop your other treatments. It does not take over from your primary care doctor. It simply adds a layer of care that focuses on how you feel today and every day. If you or someone you love has PVD, peripheral vascular disease, and the symptoms have started to take over daily life, disrupting sleep, limiting movement, affecting mood, that is the sign. You can ask for a palliative care consult. You can bring it up to your next appointment and tell your doctor, I need help managing these symptoms. Can we talk about palliative care? That one question can change a lot. Now, sometimes families are not sure how to bring it up with the doctor or what question to even ask. They're not sure if what they are saying is too serious enough. If that's where you are, that's okay. That is completely normal place to be at. Sometimes it helps to talk it through with someone who understands how these situations unfold. That's something I do with families one-on-one, helping you understand what you're seeing, what the next step might be, and what questions to bring up to your medical team. It's not a diagnosis, it's not a prescription, it's a guidance and clarity when you need the most. If that would be helpful for you, visit my website at nurserupal.com and click on Community Resources. PVD is hard disease to live with, not because of one dramatic moment, but because of the slow daily grind of pain and limitation. You deserve more than just information about what caused it. You deserve support for what it feels like to live with it. Palliative care exists for exactly that reason. So in our next episode, we're going to talk about stroke, a cerebrovascular disease that can change life in an instant, and what families need to know to navigate the road after. I'll see you next time. Take care.